Osar with Fitness Insider and Fitness Education Seminars. Welcome to part 3 of the Psoas. In part 1 we looked at the myths of the Psoas. In part 2 of the series we looked at the function of the Psoas. And what we said basically was the Psoas fascially attaches to the diaphragm. It blends from T12 to L5 on the vertebral levels, the disc levels, and the transverse processes of all these vertebrae. And then it fascially blends with the pelvic floor and then attaches to the front of the pelvis itself. So, looking at the attachments, we know that the psoas probably functions as much more of a spinal and pelvic stabilizer rather than a hip flexor. And in this hip flexion role, it probably helps stabilize and centrate the hip and the acetabulum rather than actually contributing to the hip flexion motion. So again, when we train and condition the psoas, we have to take into consideration those two functions. Its role as a spinal and pelvic stabilizer, as well as its role in centrating the hip in the acetabulum. So we're going to look at Melissa and see how well her psoas is functioning and quick, easy tips that you can look at to pick up this function in your clients. A lot of times we look at anterior posterior pelvic tilt and we realize that, or we think that, an anterior tilt just means the psoas is short and tight. But if you look at the attachments of the psoas probably is much more of a posterior tilter than it is an anterior tilter. And what we're going to find out is the psoas is dysfunctional in both the anterior tilted client and the client with a posterior tilt. Because again, it's not doing its job to stabilize the spine and pelvis, it's allowing it to collapse into a posterior tilt, and they're probably over-gripping with their deep hips and their abdominals, or they're allowing the psoas to become overstretched and weak as well in an anterior tilted client. So either client needs training of their psoas and deep stabilizers. A quick easy assessment you can do on your clients is I'm going to have Melissa activate her core and see how well she can dissociate her hip side to side. So first I'm going to have her do her right side, so she's going to activate and just drop that hip, do a bent knee fall out, and you see how well she can drop the hip out and bring it back in without changing the level of her pelvis. One more time, Melissa. And then she's able to bring it back in with no change of pelvis position. Now let's try the other side. So now she'll let the leg fall out, and you see how the leg starts to pull the entire pelvis with it. Bring it back in. I'll put my thumbs on her ASISs, go ahead. And you see how it tilts, and this side drops down, the right side comes up. So she's either got poor stabilization here and or she's got an inability to dissociate her hip from her pelvis. In that case, what I would do on Melissa is palpate around here, release any restrictions, so she could have some restrictions in the TFL rectus femoris, she can have some posterior capsule or anterior capsule tightness. I would release that, and then come back and recheck it. I may have to do some activation through her core first to see if she's maybe just has poor core function. So this is a quick, easy way to see if it's a myofascial restriction and or a core stabilization restriction. I'd come back and recheck it. Once I did that, now I'd have her combine core activation, breathing, because again, the psoas has a function on both the diaphragm and the pelvic floor. We've shown this pattern in the past. So Melissa, bring your legs up, heels up towards the ceiling. She's going to put her hands on either side of her thighs. She's going to activate her core again. She's going to push out into her hands lightly and then breathe down deep into her abdomen. So we get pelvic floor, we align the pelvic floor and the diaphragm to improve that function of the thoraco-pelvic canister. She's going to breathe side to side to activate those posterior and lateral sides of the abdominal wall. And I want to make sure she keeps breathing down that way. I want to make sure she keeps the hip flexors relaxed like the TFL, rectus femoris, sartorius, and she's doing a nice job there. She keeps them nice and relaxed, and she gets just a little bit of pressure, about 10% pressure into her hands to get the abductors, hip flexors, as in the psoas, and the deep rotators activated through the pattern. And then she'll slowly relax her legs back down. I'll do that for a series of 3 to 5 repetitions for about 3 to 5 deep breaths per repetition. That gets her to align that thoraco-pelvic canister, gets her to activate the deep abdominal wall, helps her use that psoas in its function of centrating and dropping the hip back into the socket. And like I said, I may have to do some soft tissue release first. I may have to do some activation first prior to doing this pattern, but the this is a great pattern to start to improve the function of her psoas and deep core stabilizers. And this will also be the pattern that we then bring her up into the upright position and start her into her squat progression, start her into her lunge progression with a proper hip-centrated position. So again, this is Dr. Evan Osar with Fitness Insider, looking at the function of the psoas, how to start to incorporate it back into a more of its functional role as a spinal stabilizer and as part of the deep stabilization system, and coordinating breathing and activation at the same time. Thank you. Hope you enjoyed this series, and we'll catch you next time.